Hello students, here I am with my next video. Today we are going to learn scapula. Okay, scapula is also called as shoulder blade. This is scapula. See, it is a flat kind of bone and it is placed in the posterolateral aspect of the thoracic cage. What is the thoracic cage? Thoracic cage gives protection to the heart and lungs. Okay, so on the posterolateral aspect of the thoracic cage, the bone lies like this way. So how to decide the side of scapula? For that we have to see first. See, it has three borders. Out of three, the lateral border is thickest. The lateral border is thickest one. Okay, out of three angles, it has three angles, 1, 2 and 3. Out of three angles, lateral angle bears glenoid cavity. This is the glenoid cavity which get articulate with the head of humerus to form the shoulder joint. Okay, and it has two surfaces. This is the costal surface and this one is the dorsal surface. So dorsal surface is directed backward and it is convex and divided by this spinous process into small supraspinatus fossa and large infraspinatus fossa. While the costal surface is concave, it is directed forwards. Okay, so that's why this is the scapula of left side. Okay, now if I hold like this, the lateral border is the thickest one, the glenoid cavity is directed laterally, but what is happening? The dorsal surface is directed anteriorly on forwards, so it is not correct. So that's why this scapula belongs to left side. Now the bony features of the scapula. The scapula has three angles: lateral angle, superior angle and inferior angle. Three borders: superior border, medial border and lateral border. Three processes: the spinous process, acromion process. The spine get expanded to form laterally to form the acromion process, and towards the anterior side, this is the Krobic like process called as the coracoid process. This is the coracoid process. This is the spinous process and this is the expanded portion is the acromion process. So it has three angles, three borders, three processes and two surfaces. This is the costal surface which is concave and this is the dorsal surface which is convex and divided by this spine. Okay, now one by one we'll see the structures. Now see the angles. The superior angle. The superior angle, it is covered by, on its posterior side, it is covered by this trapezius muscle like this. Okay, this is the superior angle which is formed by the superior border and medial border, and it is covered by trapezius muscle. The inferior angle is formed by the medial border and lateral border, and it is covered like this way by the latissimus dorsi muscle. Okay, now the lateral angle. The lateral angle is also called as the glenoidal angle because it bears the glenoid cavity which get articulate with the head of humerus to form the shoulder joint. It is much smaller as compared with the head of humerus, but the glenoidal labrum is the ligament which gives strength and depth to which provides the depth for the articulation of head of humerus. Now the three borders. The superior border is small as compared with the remaining two. The superior border is small and thin, and its lateral towards its lateral end or at the base of coracoid process, it shows the suprascapular notch. Here is the suprascapular notch. Now the medial border, it starts at the superior angle and end at the inferior angle. It is also thin. And the lateral border, the three borders, the superior border, medial border, and the lateral border. The lateral border is the thickest among the three borders. It starts just below the glenoid cavity. Here is the infraglenoid tubercle. At its upper end, it represents the infraglenoid tubercle, and it goes downwards and meets the inferior angle. Okay. Now the two surfaces. The costal surface, see, it is a slight concave. It is directed forwards and towards the medial side. Forwards, medially. Okay. And it has three prominent ridges present on it. See, these are the ridges. And one among these ridges adjoins the border, lateral border, to form the lever for the overhead abduction of the shoulder, like this. Okay, this action. So the costal surface is concave. It is directed forwards and medially, and it is as it is a concavity is there. That's why it is also called as the subscapular fossa. Okay, subscapular fossa. The dorsal surface, it is convex, and it is directed backwards and laterally, and it is divided by this triangular spinous process into small supraspinatus fossa and large infraspinatus fossa, and both the fossa communicate through this notch. This is the spinoglenoidal notch. See, here is my finger and here, and this is the spinoglenoid notch through which both the fossas communicate with each other. Okay. Now the processes. First, this is the coracoid process. It looks like a crow's beak. It is directed towards anteriorly towards lateral side. Okay, a bent like process. And second, the spinous process. It is a triangular spinous process, and it has crest, which is also called as the posterior border, and the crest has the upper and lower lip. Okay, so that's why it has three borders, and this is the superior surface, and this one is the inferior surface of spine. And the expansion of spine, this is the expansion of spine, it is called as the acromion process. Now this acromion process also has, this is the lateral border, as it comes on lateral side. This is the lateral border, and this is the medial border. This is the medial border, this is the lateral border, this is the inferior surface, and this is the superior surface. See, again, this is the superior surface, this is the inferior surface, this is the lateral border, and this is the medial border. Okay, as it is the bone of left side, so this one is the lateral and this one is the medial border. So here you can see the facet or the articular facet for the articulation of, yes, lateral end of, yes, clavicle, to form the acromioclavicular joint. Okay, so in this way the acromion process has lateral border, medial border has the articular facet, superior surface and inferior surface. Okay, so see students, the scapula usually every year or every anatomy teacher starts with the upper limb bones and scapula, clavicle. So students, this bone likes very much, and but sometimes they didn't understand the side determination and bony features of the bone. So it is very easy to remember the three angles: the lateral angle or glenoidal angle, the superior angle and inferior angle, the medial border, the lateral border and superior border. The notch is suprascapular notch, and here is the notch is the spinoglenoidal notch, which communicates the supraspinatus fossa with the infraspinatus fossa. This is the spinoglenoidal notch. Okay, and three processes: the spinous process along with three borders. The expansion of spine is called as the acromion process, and this is the beak-like process is the coracoid process. Okay, so in next video we will see the attachments of scapula. So keep watching videos, students, and raise your queries by doing WhatsApp on my number given in the description box. Okay, thank you.